Hello everyone, my name is Dr. Air and I'll be talking to you about nicotine replacement therapy today. I recently treated a 47-year-old male who had come to me smoking 2 packs of cigarettes every day, and unfortunately had developed COPD and was struggling with his breathing. We started him on the patch and we were able to taper that down slowly over several weeks, and he was eventually able to quit smoking cigarettes. Nicotine replacement therapy helps you cut down on how much you smoke and ultimately helps you stop smoking. The nicotine replacement therapy comes as the patch, the lozenges, the nasal spray, the gum, as well as the inhalers. And usually I advise people to start with the patch, and that's for various reasons, one of which is it's readily available over the counter, so you can actually get it without a doctor's prescription. In addition to that, it also creates a steady release of nicotine into your system, so that helps immensely with cravings for cigarettes. For people who are light smokers, however, I usually would advise to start with the gum. In terms of dosing, the nicotine replacement therapy patch comes as the 7, 14, and 21 milligrams. For those who smoke less than 10 cigarettes a day, usually the advice is to start out at the 14 milligram patch, and you do that for 6 weeks and then switch over to the 7 milligram for another 2 weeks and then stop. Now, for those smoking more than 10 cigarettes a day, the advice is to start at 21 milligrams for 6 weeks and then 14 milligrams for another 2 weeks and 7 milligrams for another 2 weeks and then stop. Usually the advice is to apply the patch the same time every day, and most people tend to apply the patch in the mornings every day and then switch it every morning. It's advisable to stop smoking cigarettes though before you start any nicotine replacement therapy, and the reason for that is it can potentially cause nicotine toxicity. One of the commonest presentation for that is nausea. Now, when it comes to side effects, all medications have side effects, but nicotine replacement therapy is fairly safe. There are, however, some side effects you need to be aware of, one of which is skin irritation. And the reason it causes irritation of the skin is because the patch contains an adhesive that could irritate the skin. So the advice is always to rotate the placement of the patch to avoid the skin irritation. And you can do that by starting with the first patch on your upper left chest area, and then left shoulder, left upper back, right shoulder, right upper chest, and then back again to your left upper chest area. In cases where you end up developing any skin irritation, in a lot of cases, just a simple over-the-counter steroid cream will help with that. One of the beauties of the patch as well is it doesn't require you to shave even if you're somewhat hairy, and it's clear and hard to spot for those who may feel embarrassed about wearing a patch and walking around with it. And you can also swim with it as well. Other side effects include headaches, increased heart rate and blood pressure, insomnia, which is difficulty sleeping, as well as abnormal dreams. In terms of abnormal dreams, it could present as vivid dreams or it could present as nightmares. And what some people do is simply take off the patch at night prior to going into bed to avoid those abnormal dreams. Another important thing to note is that the nicotine patch can be combined with other nicotine replacement therapies. So you could have the patch and the gum, or the patch and the lozenges, for instance. With the gum though, you want to be very careful how you chew it. You don't chew it like a regular chewing gum. You have to chew a little bit until you feel the pepper sensation or the bitter taste, and then pack it between your gum and cheek for a little bit, and then just switch it from side to side. Most gums will release about 2 to 4 milligrams of nicotine, and it's a shorter half-life, usually would last about 30 minutes. As much as nicotine replacement therapy is very helpful, I'd like to say that it is an aid. It's not a silver bullet, it's not a magic elixir. It's really important for you to develop the right mindset and also the right framework or roadmap, so to speak, prior to commencing this journey to quit smoking, so that you set yourself up for success. But imagine if you went ahead and utilized nicotine replacement therapy or any other form of smoking cessation for that matter, and you were able to stop smoking. You were able to breathe better, you're able to smell better, look better, you're able to save more money, and also save your loved ones from the effects of secondhand smoke. It's definitely worth a shot. I'll be bringing you more tips on how to quit smoking in subsequent videos, so subscribe to my YouTube channel and I will talk to you soon.